The Utah legislature took important steps forward in treating mental and behavioral health during the recently concluded 2024 general legislative session. One of the heavier policy lifts addressed licensure requirements for mental and behavioral health specialists. Joining us to take a look at the nuances of this bill and its impact are some of the key players in the effort. Margaret Busse is the executive director of the Utah Department of Commerce. Senator Kurt Bramble is the sponsor of the legislation. Brett Graham is a special advisor to the university president for innovation and collaboration at the University of Utah. Jeff Shumway is the director of the Utah Office of Licensure Review. And Angela Kimball from Inseparable, a national nonprofit organization dedicated to improving the way we approach mental and behavioral health. Thank you all for joining us. Let's dive right in. My first question is to you, Margaret. Could you start by helping us understand the pre-existing challenges with licensure requirements for mental and behavioral health specialists in Utah? And what was the need that sparked the discussion for what became Senate Bill 26?
Yeah, great question. And thank you for having me today. So a couple of thoughts on that. First, we knew that as a state, we were probably a little overregulated in a lot of our professions. And Governor Spencer Cox's very first executive order when he first took office was for all of his agencies to look at their licensing requirements and see where there were ways to unburden some of those licensing requirements as a way to unleash our workforce. And so really our Office of Professional Licensure Review, that idea for that office came from the work that we were doing in the executive order for Governor Cox. And one of the things that we learned is about a third of our workforce is regulated by the state in some way. And the question is, are they regulated in the right way? Given how many things are changing in our economy, how do we not look at those regulations on an ongoing basis, particularly when we have workforce issues? And when we looked at behavior health, mental health in the state of Utah, we, along with all the other states in the U.S. right now, are having a mental health crisis. And one of the contributing factors, of course, to this crisis is the lack of workers. And so that's what spurred us to want to look at this and do a deep dive into behavior health licensure to see if there were ways that by looking at this and restructuring it, we could really free up workforce to help address the mental health crisis. And so that was really the genesis of all of this. And of course, one of the things we found early on, two big things. One is, in fact, we did have a huge access issue. About 500,000 people in the state of Utah receive mental health care or behavior health care. But another between 200 and 500,000, depending on how you count it, have diagnosable conditions where they would need behavioral health care, and they're not being addressed. And that is a huge problem. And so one of the other things that we learned during this process that Jeff and his team shared in their insights is that the workforce structure, the structure of the behavioral health care workforce is not attuned to delivering services cheaply, at scale, and in an efficient way. And the reason for that is that almost everyone that is in the behavioral health care workforce has to have a master's degree or above. And so unlike in the physical care workforce, you don't have lower level licensed professionals that can step in as extenders for the expertise of a master's level or a PhD level. You just don't have them like you have nurses and CNAs and others in the medical workforce. And so that was one of the key insights that Oppler brought and helped us to realize that what we needed to focus on first and foremost was access, and how do we get more people to broaden that access, right? And so, and that comes in the form of creating more of these lower level extender roles, as we like to call them, and also finding alternative pathways for people to be able to get their licenses. So that was really, I think, that the beginnings of what we were trying to solve for, those two insights.
And it's worth mentioning this bill was signed just a few moments ago. Like within the last hour, this became law. I know, and Margaret, you got to be a part of that. I think you had the bill right there with you, if I'm not mistaken. So there it is. It's officially, it's officially law. I don't know if the ink is even dried.
right here, and well, this bill will get to go in Jeff Shumway's office for a keepsake for the amazing accomplishments that Oppler did. And what's interesting about it is it's the insight that looking at our regulatory policy can have profound implications on our society. I think that's the key takeaway at the 64,000 foot level.
All right, Senator Kurt Bramble, as the sponsor of the bill, what were your primary objectives in proposing Senate Bill 26? What were you trying to get done here?
Well, it's multifaceted, Marty. First of all, the review from Oppler made a compelling case that access to mental health services needed to change in Utah. We needed to change the conceptual framework of how we deliver those services. That's the primary purpose of the language of the bill. But as we talked in the governor's office earlier this morning, there's a broader issue that Senate Bill 26 really represents, and that is changing the culture of the licensing process and what licensing really should be in terms of protecting public health and safety and really not protecting turf just for turf's sake. So the language of the bill is critical in terms of how we have restructured the continuum of mental health services, from counseling to therapy to psychology, psychiatry, etc. But it was really broader than that, because we're trying to change the culture of the legislature and the executive branch as we look at licensing as a function of government.
You've been in government for a long time, 24 years in the legislature in particular. Do you see this as just sort of the natural result of every year we pass bills and they make new laws and new regulations come from that? And at times that needs some serious review and pruning, if not overhaul.
I think across the country, when I was president of the National Conference of State Legislatures, they had a task force directed at occupational licensing and are licenses creating barriers to entry, or are they really necessary to protect public health? And it's easy as a legislator. Look, you've been a lobbyist. It's easy as a legislator to take a request from a constituent or a lobbyist, and you make a compelling case that an activity to protect public health, we really need to license this activity. And yet, when you step back and do a critical, quantifiable, objective look at it, you say, well, maybe registration, maybe some form of certification, something less than full-blown licensing with licensing board and such, maybe that would work in particular circumstances, and maybe we don't need much of anything.
Yeah, it's something always worth examining. I wonder, Senator, as you went through this process, how did you balance the need for regulatory oversight with the need for more accessible mental health services?
Yeah, that's a great question, because the more of one, the less of the other, and it's a balancing act. We relied heavily on the work of the Office of Professional License and Review. Jeff Shumway and his team, we wouldn't be here today having had the signing ceremony for Senate Bill 26 without the deep dive, the analytic work of the Oppler team, without Director Bussey's unwavering support, without the governor's commitment. When the governor told the continuum of licenses, look, we're going to do a deep dive, and some of you may not like this, but if you oppose it, it may not turn out well for you. That was sending a clear message, a unified message between the legislature and the governor's office and the cabinet, that we were serious about how are we going to rebalance this. Because look, when you have hundreds of thousands of citizens that have no access to mental health, the risk to the public in general is much greater when you have that level of non-access, of no ability to get access to mental health. That creates a risk to in the public square regardless. And so changing hours of supervision to look at the quality of the supervision rather than just the hours, looking at how the education and the continuum of everything that we looked at, it simply was intuitive. It made sense when we got the final report. That's why, but for a couple of I'd say odd legislators out, there were a couple that voiced some concern, but generally speaking, the bill flew through the legislature because of the foundation that was laid by the entire team. That includes the professions themselves, the psychologists, the psychiatrists, the therapists, across the board. They were at the table, and they didn't like some of the stuff, but they recognized overall we're better off with the provisions of 26 than without.
Congratulations as well to you, Jeff. I want to come to you next because I know a lot of this started with you doing a lot of that policy digging. Could you walk us through the policy making process on this? What were the key considerations and hurdles that you faced in drafting and refining the bill, especially regarding stakeholder involvement and consensus building?
Yeah, well, interestingly, it really started late 2022. So our office is new. We were created in July of 2022. We identified behavioral health as the first big review we wanted to do and started reaching out to folks in the industry associations, others who were interested almost right away within the first few months. And so it's really been since fall of 2022 that we've been engaging with practitioners, licensees, employers, insurers, a lot of executive branch partners in higher ed and in insurance, in Department of Health and Human Services across the board. The intent of our office is really to make sure that policymaking around licensure puts the consumer right at the center, right? Because it's very typical for the industry associations to come and have a point of view on what they want in terms of licensure, and that's fine, and they're an appropriate stakeholder to have there. But the customer is who we're actually trying to serve. We're trying to keep them safe and make sure they have sufficient access. And so what we did in the policymaking kind of development phase was we talked with a whole lot of stakeholders, so literally in the hundreds of people who were interested. But then we also looked at data, specifically data from the Division of Professional Licensure here in the Department of Commerce that does the licensing. We looked at their complaints. We looked at how many of which occupations we have here. We also looked at national data sets to understand the access problem, as Margaret mentioned, to understand the rate at which we were having, quote, adverse actions, meaning when there was a problem with a behavioral health practitioner and they had a license encumbered here or elsewhere. And we were able to compare that across states. And then we also looked at the academic articles and studies around behavioral health and licensure and what keeps people safe and what impedes access. And so through that process, we came up with a number of recommendations. At one point, we had a spreadsheet with 360 different ideas that people had given us through surveys and focus groups and us reading these articles. We winnowed that down to 12 to 15 and eventually collapsed it even further. And then we went back to those same stakeholders to vet those recommendations, to understand how that would be understood by practitioners and licensees and employers and insurers, et cetera. And that helped us refine some more. We dropped some recommendations. We significantly changed others. And so by the time we got to the legislative session and drafting, we had a pretty well vetted we had a pretty grounded understanding of what was going on in the state and licensure, and also a pretty good understanding of how people would respond to these recommendations and could they be implemented.
Understanding the problem is always a key part of things when you're going to dig in and try to make some corrections. So I appreciate that insight. Brett, I want to come to you in your role as special advisor to the university president for innovation and collaboration at the University of Utah. How do you see this bill influencing academic and research approaches to mental health? Additionally, how might this legislation foster innovation and collaboration in mental health practices across educational institutions?
Thank you, Marty. As Director Bussey was talking, it just really struck me about how really the University of Utah finds itself in this unique position where we're partnering with the Department of Commerce, the state, and others in the community in terms of what needs to happen. We're a provider of services. We're an academic medical center, and we're a health system. So we're one of the partners in the community that is providing this care, this vital care. We're also an educator, where we educate not all, but many of those that are providing this key service. And then we also have a research component. The Huntsman Mental Health Center and Institute is is one that is exactly positioned to do what you're talking about, is learn from this and provide better care. And then finally, we're a small city, right? If you take all the students and also the actual, faculty, staff, and others at the University of Utah, we're a community that often receives these care. So in partnering in all those things, there's been a lot that has been done to collaborate with and across the system of in the state of Utah, with government, state, first and foremost, but also local and community. Where I see this really having an impact is we've had a chance to now review what we do, right, across the system of higher education, but also specifically at the University of Utah. Dr. Montoya, who's the provost, reached out to all of the colleges in the university and said, what are you doing right now that provides training for those that provide this critical service, and what do we need to do to change that or improve or increase, and how might we add additional seats for people to learn, and what do we do in terms of innovating around the new licensure so that we can support and welcome in the various steps that both help meet the need across the state, but also invite people into the service, into the providing mental health resources and services to patients. And finally, another thing too that we haven't talked about that I think is really important is when students go to school, they want to have outcomes and they ultimately want to work in the field in which they are studying. And so this actually helps to provide some steps that we believe will not only serve the community better, it'll also help students have clear paths to what they ultimately have studied and are best positioned to do long term. So we've been a partner along the whole way. We know that this is not done and there's much more to be done, but we have been appreciative of and along for the entire process.
Margaret, I want to follow up on that with you just because it's so common, I think, across the country for government to say, we're going to go make fixes and change things and not touch base with the folks who are going to be impacted by that. Having that type of collaborative relationship with the universities, with the higher education system, with the University of Utah in particular, that had to be essential to this overall effort.
Yeah, it's exactly what I was just going to comment on, Marty. And one of the great things about Utah, of course, is that we do have this collaborative environment, that there are connections across different institutions, and so that we can make these kinds of systemic changes that need to be made. We can do the licensing review. We can change things in legislation to create different license types, like with what this is proposing to do. But we can't create those programs within higher ed to train the students. That has to be institutions like the University of Utah and others within the state to do that. And we can't be the care providers either that have to shift their models and how to provide the care. And so all of this has to be done kind of at the same time. And in order for us to do that, we have to be able to have those connections. And so, when we came to the University of Utah and connected with them, there was such an appetite and willingness to partner on this, which is essential. I mean, they could simply say, you know what, we don't really care. Great, you're going to offer those license types, but we don't care about that. And so it really takes the leadership of the University of Utah, of our institutions of higher ed, to do this, to really activate the change that we need.
Angela, I want to get to you with a national perspective on this. How does this policy change in Utah compare to what you've seen as far as other states and their approaches? How does the bill address major workforce concerns from your perspective? And then I'd love to just kind of see how Utah fits into the national picture.
Thanks for that question, Marty. First, I want to congratulate Director Bussey, Jeff Shumway, the Cox administration, Senator Bramble for their incredible work on passing this legislation. It's a really tremendous accomplishment. And as you just alluded to, workforce issues are all across the country. Every legislator is worried about these in every state that we work in. But I think what I really appreciate about Utah is this data and research-driven approach. the work that Director Bussey and Jeff did in terms of laying the foundation with a solid understanding of what the licensure and credentialing barriers were is really, really important. That laid a tremendous foundation for addressing a foundational barrier to actually getting to the workforce solutions that we need. And really, it was such a collaborative effort from everything that I've heard, bringing the University of Utah to the table, providers, advocates, everyone around to really look at the issue from different perspectives. And I wish we saw more of that around the country, to be honest, that kind of thoughtful, data-driven decision-making. And what it resulted in is really good legislation. And I want to mention particularly that it addresses several different parts of that workforce issue. It strengthens the existing workforce. It gives Utah's mental health providers the opportunity to work at the top of their license and really leverage their expertise in a better way. It gets more people in that workforce pipeline practicing quickly by modernizing and streamlining the licensure and credentialing pathways. And it created those alternative pathways while at the same time ensuring greater safety. That was one of the things I appreciated, is that attention on adding checks and balances and making sure that there's direct supervision requirements that are substantive. I also appreciate that those new pathways create new levels of behavioral health providers. And as Director Bussey said, we have health extenders in the physical health world. We haven't been using them as much in the mental health world, yet there's an incredibly valuable role that those mental health extenders can play. And now you have certified behavioral health technicians as a pathway. You have behavioral health coaches licensed as a pathway to help fill some of those workforce challenges. Really, I think other states can learn not only from the collaboration that I see in Utah, but also this thoughtful approach to really building a solid foundation and then attacking the next step.
I want to extend that to the rest of the group and get everyone's thoughts on this. I'd love to talk just sort of where the rubber meets the road. How will the changes from this legislation specifically benefit mental and behavioral health professionals? And in turn, how does it benefit Utah residents seeking their services? I'd love to start with Margaret on this, but then have everyone else jump in.
Yeah, I think this will benefit mental health care professionals in a couple of ways. One, to be able to get to be a licensed mental health professional, it's going to be a little bit easier. And there's going to be multiple pathways to do it. So part of it is we're taking out some of the things that maybe are not related to safety and requiring the things that are related to safety. That's a key thing. Then once you are a professional, to be able to rely on extenders in this space, as Angela just described, these mental health professionals will be able to work at the top of their license, at the top of their training. And so now they can focus 100% on helping the patient, helping the client, versus having to do some other things that some lower level licensed folks can do and help with. So that's going to be huge for these folks and a huge relief. And then, of course, because we have more people in the space, these mental health professionals will be able to service more people. And that's the full impact that we are looking for, that more people can access the resource of mental health care.
Brett, let's go to you. Any thoughts?
Yeah, ultimately, as Margaret suggested, look, this is all about impact, right? It's impact for individuals, for families. It's trying to alleviate, is to the extent possible, just the challenges associated with living with mental illness. And right now, we know that most of the people who are suffering with mental illness in the state of Utah are not getting adequate care, right? Whether they're adults or children, for various reasons, there's just not the the availability of care, or people are not pursuing it. And so anytime we can expand the workforce and make it more effective and efficient, this is a great thing, right? So one of the things at the University of Utah we do is we provide much of the crisis, or we coordinate much of the crisis response across the state. Challenges that we have are actually getting professionals, right? They don't exist. We don't have enough of them. And so this helps to direct pathways towards that. And as we talk about it, as your bills are passed, it also creates better awareness and hopefully addresses some of the stigma associated with mental illness. And so all of this is in a greater context. And it's also part of a kind of a relay race, if you will. If you go back to what has preceded this great effort in terms of what the state's done, what the government's done, and different providers have done to just create greater awareness and provide care, this is a natural and important step in providing more care. This clearly is not done. We've got a lot more to do, right? And in fact, I imagine the Department of Commerce will be very engaged here, not only in other licensure areas, but behavioral health going forward, because we'll learn some things and then we'll come back and collaborate some more and change and improve even more. But I think this is a good step going forward.
Jeff, I want to give you a chance to jump in here as well.
Yeah, there's an interesting dynamic with supervision that no one's touched on yet that I want to speak to. The practitioners who are doing this work, who are providing specialty therapy, day in, day out, it's a difficult job. And, they're not paid at the top of what our economy pays people either. Many of them are feeling burnt out. And so when we talked about requiring additional forms of supervision or more direct observation, et cetera, they were worried. But I think there's an interesting dynamic here where people are also rotating out and leaving the field because they don't feel well supported. So my hope is that this is actually going to make life better for the professionals in that they will get more consistent, high quality supervision at the beginning of their careers. And then we've also created opportunities for them to use peer consultation and peer direct observation throughout their careers to count as continuing education. And I think that connection to peers, the connection to other licensees, other professionals, can actually help us retain more people in the workforce longer, which solves two problems. It makes people safer, and it keeps our workforce happy, healthy, and engaged for longer than,
And Marty, can I make I'm sorry, Jeff. Can I make another comment, just building on what both Brett and Jeff have said? So this idea of getting more people into the workforce, helping our safety issue as well, is huge. And this was an insight that Governor Cox had when we presented our data to him. And, we said, there's an access problem. There's also a safety problem. And his insight was when there's such a constrained access and so much pressure on these providers, that's when you can, see safety issues because of that pressure. And so sometimes people think of those two things as being on different axes, and one causing the other in a different direction, which I think is really interesting. The other thing I wanted to point out, and one of the reasons that Governor Cox is so interested in behavioral health care is, he knows we have a mental health crisis. He's tried to address that, with social media regulation and those kinds of things as well. But we have a huge homelessness problem also in Utah. And I think he's very excited about being able to use, expand access to behavioral health care as a way to help our homeless population, many of whom suffer from mental health issues and behavioral health issues. And so, when you're talking about what kind of effect will this have on the ground, this could directly help the issues that we have around homelessness. I also just was chatting with the director of our Department of Corrections, and he is desperate for these lower level technicians to come in and help provide services to the incarcerated. And so it's throughout the state where we have issues that need to be addressed, that if they are addressed, not only are you helping those individuals, but you're helping our entire society to function better, frankly, right? People that are committing crimes, sometimes they have mental health issues. Many times people are homeless because of their mental health issues. And so the knock-on effects are incredibly profound, and this is why it has been such an incredible emphasis of the Cox administration, of Governor Cox.
Senator, you just announced that this was your final general legislative session, so I'm going to frame this saying you don't have to actually solve this problem. You get to watch it from the sidelines like many of us. So knowing that a piece of legislation rarely solves all the problems, where do you see we still may need to make some efforts going forward?
Well, Marty, there's no having been there 24 years, there's no piece of legislation that's perfect, number one. The vast majority of what we do is simply tweaking existing statutes, fine-tuning them as business models, as society changes. We try to keep our laws updated, and statutes will always be behind the curve. There's no question whether it's tax, mental health, it doesn't matter. But the other point of announcing that this will be my last, that I'll step aside from serving in the Senate after 24 years, every year there's going to be the next big issue. Every year, this is an ongoing process. It's not a destination. With licensing, 10 years from now, 20 years from now, 50 years from now, the legislature will still be having debates on fine-tuning licenses. We can't even imagine the types of professions that are going to arise. Look at artificial intelligence as an example. How's that going to be regulated? How's that going to be? Will there be any licensing in artificial intelligence? 20 years ago, we couldn't imagine, 24 years ago, we were messaging with AOL Messenger and dial-up modems, and the phrase "you've got mail" resonated. No one could have seen 24 years later what cloud computing and everything does. So the idea of what's going to happen in the future, what happens with Senate Bill 26, I'm certain that there will be some fine-tuning adjustments, whether it's next session or in the following sessions, as we implement 26, as we work out the kinks of these major changes. Yes, there will be some fine-tuning. There will be fine-tuning with administrative rules. There'll be fine-tuning with how DOPL, when you have a combined board, a multidiscipline professional board, how are we going to implement the subcommittees or the ad hoc committees for reviewing the particular licenses that the board has oversight on? That it's not just psychologists or psychiatrists or therapists, but this now multidisciplinary board. How will that function, and what kind of either rules or statutory changes will we need to make, because we're not anticipating and we can't foresee today what the challenges next year might look like. So it's a process, not a destination. It's been a privilege. This journey didn't begin with Senate Bill 26, and frankly, it didn't begin with Oppler. It began when, and even it predated Governor Cox when he was elected, but it was put on steroids. It was accelerated with Governor Cox and his administration, and I look forward to seeing how it plays out. But the question is, well, what will happen in the future? What about 26 or the subsequent elements, either of 26 or other licensing? All I can say is stay tuned.
Well said. I would just note that there's probably nothing you can do to improve your mental health quite like retiring from the legislature. So that's probably the biggest step that Senator Bramble took on his own this time around.
My wife says that there's a time and season, and she can't get past the phrase 24 years. Number one, it's a long time. But number two, she feels like we've put our heart and soul, and it's been a team effort for she and I, and we've left it all on the field of play. We don't have any regrets about having served during that time.
Angela, I suppose that matches up with what you're seeing nationally, that if you make the process better as far as licensure and training and everything you need for the professionals, more professionals who are qualified get into the arena where they can be of help, and that ultimately trickles down and helps the patients.
You're absolutely right, Marty. At the end of the day, this is about getting people help when and where they need it. And this legislation actually was a tremendous first step in that, because if you don't have the providers in place, people can't get that access that they need. So this was really important and a valuable way to improve the quality of life for all Utahns.
Yeah, absolutely. All right, let's wrap up with this. Looking ahead, what are your thoughts on the potential long-term impact of the bill? How do you envision this shaping the future of mental and behavioral health in Utah, and what comes next? And why don't we start with Brett on this one?
And when I answered earlier, I said there's a little bit of a kind of a relay race that these things take. And I think that's where you're saying is, okay, the baton is passed, right? So it was the role of government to say, hey, we're going to change some licensure, but we're going to do it with enough detail that it is meaningful and directional, but not so much detail that it binds people in ways in which we can't actually even do it. So the next step in the relay race is for institutions to say, okay, what does this mean, right? They've been partners along the way, but for each institution, the University of Utah, but also working with others in the system of higher education to say, okay, what certificates do we now offer? What don't we offer? What's the requirements for those? Who's going to provide them? And what resources will we use to be able to provide them? So that has already started at the University of Utah, and I'm sure at other institutions. And then they'll come back and say, okay, here's what we do, and here's the progression within fields, right? Someone might start at one institution, get an associate's degree, come to another institution, get a bachelor's degree, and we hope that they might be able to provide service to the community along the way and then be inspired to go on and pursue additional education as well, providing meaningful contributions to individuals all along the way. Research will also be done about where there's impact and where we need to improve, where we may have opportunities, but also where we might need to make some corrections. As we talk about this, I've just thought, if you take the last decade in the state of Utah with mental health, and think of what's been done, right? You go all the way back to the introduction of Safe UT, addressing some real critical issues with first K through 12. Then you roll forward with people in the community recognizing the need, and the Huntsman family specifically stepping up and making an incredible contribution, both resource and their energy, creating the Huntsman Mental Health Institute. Then you have 988, which really started in Utah, right? This is just, again, another step in a relay race facing something that is acute, and it's growing, not diminishing. So this really applaud the work of Margaret, of Jeff, and others, Senator Bramble, that have been so critical here.
Margaret and Jeff, I know this was sort of the big lift, the heavy lift, the deep dive, and now maybe we're tinkering around the margins going forward. Maybe you could comment on what's up next as far as this overall effort.
Yeah, I think it really, I actually love Brett's analogy of the relay race, because we really are handing that off to higher ed, to the providers, the care providers, and so in integrating this kind of care into their model of care. But I know that one of the things that we will be doing as a department is tracking, are we actually getting more providers into the system because of the changes that we made? And then we can start to track, is it actually helping our mental health as a state? And so we'll be looking at that. We'll also be monitoring, is it helping the safety of the patients, of the clients? So we'll be able to monitor that as well. And we can look at that very directly, of course, because we do the enforcement around safety. And we also monitor how many people are getting licensed. And so we can use that data to see if these changes are making a difference, or if we need to tinker again a bit around the edges to make sure that we have the difference that we need.
Angela, we'll give you the final word on this. You want to just tell us from your national perspective what you've seen Utah accomplish and what you see as maybe the next steps?
I think Utah has taken an important step forward and really thoughtfully addressed the issues related to the workforce, expanding it, extending it, making it clearer pathways to get people licensed, credentialed, and working, delivering that care that people need. But when I think about next steps, I really look to Gardner Policy Institute's Behavioral Health Master Plan, and that really outlines a number of different areas that Utah could be looking at as next steps. Everything from provider reimbursement rates to really encouraging evidence-based treatment options, insurance coverage, promoting prevention and early intervention. So I think this is foundational. And there are next steps to take in that journey, that relay race that gets Utah to a place where everybody is getting the right care at the right time.
I want to thank everyone on the panel for spending some time talking to us about the work that was done during this session on this issue. And of course, thanks for your work on this issue in the first place. Really appreciate the great work you do for Utah.